we have a lot of new technologies in development to detect antimicrobial resistance. And a lot of focus has been placed on detecting resistance, but really the ability to detect susceptibility is equally important. And so the traditional methods we use today are methods that are developed in the 1970s and 1980s, so it's well past time for newer technology. So ideally, a technology would be really rapid so that we can detect resistance and susceptibility in our patients as soon as possible, ideally at the bedside. And in this way, you could tailor therapy to the patient's specific infection right off the bat, rather than starting on very broad spectrum therapy and having to de-escalate or escalate as susceptibility or resistance is detected. So this being said, using a phenotypic method is really important because it can accurately detect susceptibility. And so in this way, you observe how the bacteria behaves in the presence of the antimicrobial. So there are several new technologies in development, which is very exciting to do this in a much more rapid way than the traditional methods that we use today, which from collection of a patient's specimen to results can be up to 5 days. So these methods are much more rapid. And so there are several in development. The most recent is Accelerate Diagnostics. They have a system called the Pheno system, and it does a susceptibility test directly from a positive blood culture. And this method reviews the performance of the antimicrobial against the organism in real time through microscopy. So you're actually imaging the cells and watching how they behave. And so they can do a susceptibility test within 6.5 to 7 hours. Another method that's further along in development is through a company called Lifescale, and they actually weigh the bacteria through the use of a microfluidic channel with a cantilever. And so as the organisms one by one enter this channel, they cause a change in the cantilever vibration so they can count the number of organisms. And so, of course, if the antimicrobial is killing the bacteria, there will be fewer organisms, and if it's not, there'll be lots of organisms as they continue to grow. So both those technologies we expect to see in the next year or two coming to the clinical labs. And then there are several other technologies that have been developed more to identify bacteria really rapidly, but could be adopted to do a susceptibility test. And so two include the bacteria scan method, which is an optical density measurement that counts bacteria. And again, you could count them in the presence of an antimicrobial after a given time to see if there's a reduction or an increase in the number of organisms, meaning they are either susceptible or resistant to the antimicrobial. Another technology is the one which was recently acquired by Roche, which evaluates the viability of an organism, or whether it's alive or dead, based on its ability to take up a gene, which is delivered through a bioparticle that they engineer. And so when they acquire this gene, it gives them the ability to produce light. And so you look for bacteria being alive as they generate light, and as they die, they're no longer able to generate the light. And so the lights go off as the organism is killed by the antimicrobial. And so these bioparticles can be very, very specific to a given species of bacteria, or they can be much more broad and look at a whole family of bacteria like the Enterobacteriaceae, for example.